Hey lovelies, welcome back to my channel. Thank you for watching, thank you for tuning in. well if you're a return subscriber, thank you for watching and keep watching. Recommend to your friends, recommend to your family, or anyone you know this could help. Okay, if this is your first time here, please subscribe so that every week I'll be posting. Please subscribe so that you get a notification every time I post a new video. Okay, I hope we're together in this. Okay, so if you've not, please go back through the previous videos, follow step by step to go through the EPI and then the field, to go through the EPI, go through the skills stations, and also go through the evidence-based stations, go through the professional stations. Okay, so today we're going to look at the IV flash and the VIP score. IV flash and VIP marking criteria. Okay, we all know the VIP, what the VIP means, and the IV flash. Okay, so I'll begin with I'll go through the assessment criteria, then I'll go into the how to. Remember, I try my best to give you two ways of how to go over things. One is brief, another is detailed. So you choose what works for you. The essential thing is to make sure that you are able to go through you're able to tick the assessment criteria and also mention what the assessor needs to hear from you. Okay, so let's get started. I won't waste your time. I'll also introduce my dog. This is our YouTube friend. She's always here when I need to demonstrate. She works as the mother. You see, this is a baby. She also works as the infant, the neonate, the baby. I think when I'll be doing some practicals for some videos that need to do some practicals, I think I'll try to do some demonstrations where possible, whereby I'll be able to put that maybe down and demonstrate for some, just for clarity. Okay, so let's go begin with the assessment criteria for the IV flash and VIP marking criteria. Okay, so number one checks that all the equipment required for the procedure is available, and where applicable it is sterile, i.e. the packaging is undamaged, it's intact, dry, the sterility indicators are present, and any sterilized items have changed color where applicable. So we all know that with the sterile packs, if they're taken into the autoclave and they're sterilized, the tape that they put will turn most times from green to black. That is, for my colleagues who are in Uganda, you know that's what happens with our autoclaved items. Okay, those watching from somewhere else, you I don't know the tape you use, but that's what we use. So I'll refer to something that I know, or what some people can relate to. Then also make sure you check the expiry date of each and everything. Okay, and also make sure that other items you're going to use are well calibrated and they're in date. Okay, before you begin any procedure. Number two, assesses the cannula and verbalizes signs of phlebitis. We know the signs of phlebitis, whereby you can ask the patient if they feel pain. Ask if they feel pain. Erythema is the color. Then there is edema. Then there is palpable venous cord. Then there is pyrexia. Then we also have you also have to identify two or partial and 5 to pass for a full pass. We know the signs of phlebitis. Think my arm here. I don't know if you can see. So in cases, you have to examine also the arm. So like this side, I've recently been sick, so I had a cannula here, so I think you can see this part of the skin. It was damaged. Okay, so if you see this on a patient's hand, make sure you check to see that the cannula is in a good place. It's able to take the fluids, and there's no this reddening. These are signs of there's no reddening at the cannula site, you know. So my cannula was doing the same. So that's just an example to show you what it is. Okay, then 3, cleanse hands with alcohol hand rub, or washes with soap and water and dries with paper towels following WHO guidelines. Then 4, states that the tray or trolley has been cleaned with detergent wipes or equivalent, and places all the equipment required for the procedure on the bottom shelf on the bottom shelf of the clean dressing trolley or suitable equivalent. 5, dons a disposable plastic apron. 6, takes the equipment to the person's bedside in a tray or trolley. 7, gains consent and explains the procedure to the woman. 8, before administering any prescribed drug, looks at the person's prescription chart correctly and checks the following. You check the correct person's ID, correspond with the person verbally, like the patients usually have a white band that has their name, date of birth, hospital number, NHS number. So you correspond that, and with the that's the ID they are talking about. And the person, you ask the mother, "Hi Jamil, can I please know your name and your date of birth? Can I confirm your name and date of birth?" Okay, so that's how you know. Then the correct drug, correct dose, date and time of administration, route and method of administration, diluent as possible, and you ask the mother if they has any allergies. So before I continue to 9, I think I need to show you the drug chart. Okay, so this is an example of the drug chart. This is how it looks like. Okay, so as you see, the surname, the forename, date of birth, hospital number. Okay, then you go on to the patient's weight, all that. As I said, I will be doing a video of how to fill this drug chart. Okay, in this part here, you see details of the person administering the medication. So you write your name here, initialize here, write your signature, and the base. The base is where you are. Where are you giving the medication from? Are you in labor ward? Are you in antenatal? Are you in postnatal? Where are you? So that's the base. Okay, and here we have the prescriber. Okay, the prescriber here, you see there is Sonia Pravin, their GMC number. This is the doctor. Then the signature, and then their blip number. Then we have here the name, GMC number, signature. Okay, so make sure everything is well signed by the doctor, by the pharmacist who is giving out the drug, and the drug is well dated with the correct everything. So then we go on to number 9. Correctly checks all the following. Validity of the prescription. That's what I told. Validity of the prescription. That's what I said, that the doctor should have prescribed it. Signature of the prescriber, the prescribing doctor. Is the prescription legible? It means does the prescription suit what it is treating in that patient, and is it the correct drug, right patient, right drug? Has the pharmacist given you the right drug, the right dosages? Is it well signed? Everything dated and signed properly? Is the medication safe? Is it well in date? Okay. If any of these pieces of information is missing, unclear, or illegible, the nurse shouldn't proceed with the administration and should consult the prescriber. Okay. Just as I was telling you of what you should be able to check out. Okay. Then 10, cleans hands with alcohol hand rub, or washes hands with soap and water and dries with paper towels, dons sterile gloves. 11. Cleanses the end of the needle. Free cup with sterile alcohol wipes saturated with 70% isopropyl alcohol. Chlorhexidine gluconate for 30 seconds, leaving to dry over 30 seconds. Okay, so it has a continuation. Number 12, connects the pre-filled syringe to the needle. Free cup using an aseptic non-touch technique. Actually, have you seen those needles? I don't know. I need a needle to demonstrate this because flashes the cannula using the pulsating action. The pulsating, like this, you give like you stop it, that's the pulsating action. 14 asks the woman whether there is any discomfort while she's flashing. Disposes of the waste appropriately. Remember that do not recap any needles. They should go in the safety box. Okay, and then for the other apron, the gloves, they have to go in the yellow bin. Okay, cleans hands with alcohol hand rub on, or washes hands with soap and water and dries with paper towels following WHO guidelines. Remember the WHO guidelines, they are 8. 1 on both sides, that's 2. Fingers interlaced. So you do this side, do this side. Okay, then we go to fingers interlocked. This side and that side. Then we go to social wrapping. Go to social wrapping of that. This side and this side. Then you go on to wrap the tip of the fingers. This side and that side. Then we go on to wash the wrists. Okay, then we rinse our arms, air dry for 30 seconds or dry with paper towels away. Okay, so then we cleanse the stand, then dates and signs the drug administration record. So I've shown you where you sign. Okay, and then acts professionally throughout the procedure in accordance with an NMC 2018 Code of Professional Standards of Practice Behavior for Nurses, Midwives, and Nursing Associates. Hello. Okay, let's continue. So, this is an example of something that you will receive. When you go to the mock exam, you can be able to get these copies of some example of the scenarios. So another thing to note about the drug chart, I think when I do the filling in of the drug chart, I'll tell you what else, the specifics of the drug chart. It's quite a lot. It's quite detailed because you see, you have, when you open every page, you have to read the patient's name, everything. There's nothing like you should, so that you should, that's why you should be quick. Okay, so number 1, I'm going to go with how you could administer them, how you could go about. We're now beginning the how. Okay, so I come. Hello Jamila, my name is Sarah and I'm going to be your midwife today. Are you happy for me to do I'm going to be your midwife today, and the doctor has prescribed some medication for you that I'll have to give through your IV, through the IV. Is that okay with you? Then she'll tell you yes or no. Okay, so anyway, before this, you should go on after you introduce yourself, you have to also ask the Jamila to introduce herself. Can you please confirm your name, date of birth? Can you please confirm your name, date of birth? And so you what she says corresponded to this, and make sure you have the right. So when Jamira tells you her name, make sure you cross match it with the wristband as I've told you. Then that's when you go on to ask for consent for you to do the procedure. If she says yes, then you ask her, do you have any allergies? If she has any allergies, please make sure you give her the red wristband and also add it to her documents that she has these allergies, and ask her, do the allergies, what happens when you get those that allergy? Like, let's say she said she's allergic to paracetamol. You ask her, Jamila, when you take paracetamol, what reaction do you get? Okay, make sure you also note down those details she tells you. Okay, and note it as a reported speech, like the mother said. She stated that this and this. Okay, so then you go on, okay, Jamira, the doctor prescribed medication for you. It will be through the veins, and it's the right time, the right drug to have it's the right time to have your next dose. Are you happy for me to administer it? Okay, let me prepare it. If she says yes, okay, let's assume she says yes. Okay, so I'll draw curtains, wash hands according to WHO, as I've just demonstrated back. Air dry or dry with paper towels as I look around to see that the environment is suitable for me and my mother, which means you assess the room for any slips or trips. Okay, then I go and prepare my medication and equipment to use as I review the patient's prescription. I'll get the key from the supervisor and open the drug trolley, get my fully loaded flashing water. If it's, and I'll have to check it's not broken, it's not tampered with, and it's not wet, it's not and it's still in date, not expired. Okay, so I'll get my alcohol sun drop saturated with 70% alcohol and make sure that I keep the place as sterile as possible. I'll clean my tray with detergent wipes and maintain sterility and a clean environment. I will close the cupboard and give the key back to the supervisor and come back to my patient. So, Jamira, I'm back. I'll put on my gloves and apron. Can I confirm your date of birth? Your date of birth. Can I confirm your name and date of birth? Do you have any allergies? You have to repeat. And when you read this, you have to also confirm again and go and read through the chart again to confirm you have the right patient, right drug, right dose, right, it's the right time. Okay, now I approach Jamila and I ask now I approach Jamila, ask her, can I have a look at your intravenous cannula? So you assess the cannula point, so you ask her to have a look at her cannula site. So you look out for signs of phlebitis, okay, which may be like redness, hotness, if there is a palpable vein, if there is pain, any lumps, any swellings. Okay, Madam Examiner, I can confirm to you that I have a good VIP score. Do we know how to do the VIP score? I have a VIP score chart. I don't know if it's possible. So this is the phlebitis score. Okay, it's from 0, 1, 2, 3, 4, 5. You people should pray for me so that I know how to do things, more editing, so that I'll be able to show you how to bring these things on the screen, like that. If someone is good at editing, please show me how to do it, so I can be able to zoom these papers on the screen and I show you what to do or what exactly I mean. I'm a learner in progress. Otherwise, I'm still putting papers up to the screen. Okay. So I'll confirm with my assessor that there are no signs of infection and I have a good VIP score. Then I'll look at the date on the cannula. If it's more than, so when the cannula is put in, the person who has put it in has to write the date it has been put in. And also sign against that. Okay, so this is where this comes. Then I'll look at the cannula and check the date. If it's more than 72 hours, it's not okay to use. Those are 3 days. So since there are no signs of infections, I'm happy to tell you that I can go on with the procedure. That means you've not seen any signs of phlebitis at the site where you're going to give the IV fluids, okay, or the IV medication. So I'll connect my IV fluid to the cannula port and administer slowly, using the heart rate rhythm while looking at Jamira to rule out any pain and visualize and verbalize if it's paining. Remember what I told you, that the heartbeat rhythm. I need to get a needle. I need to get a needle and be again. So, and also this is to be sure that it's going on slowly without any resistance, and also make sure you're using the pulsating mode. So we also have to make sure it's not swelling, and after flushing it and giving it slowly, you're going to withdraw using the non-touch technique and then clean the pot. Okay, then you're going to explain to Jamira and tell her that if she sees any signs of infection, e.g. pain, feels hot, becomes red, or if it starts swelling, she must inform us immediately. So then you go on to thank your mother. Thank you, Jamira. A minute. We didn't explain to Jamira the drug. I forgot that part. You have to explain before we give before we're going to prepare the medication. We tell her, yes, she may know about it, but you have to repeat it. This doctor prescribed this drug. It's for this, the reason for the drug. Like, what is it going to do? Is it going to help her with pain? Is it an antibiotic? If you go through our medication, I talked about the medications that are usually administered, okay, like betamethasone, the antibiotics, yeah, and then the painkillers. So if you go through our previous videos, you'll be able to see that. So we thank the mother for her cooperation. I'll go on and finish up the documentation that I've given this drug at such and such a time. I have to sign all, and then if I've not given any drug that I'm supposed to give that time, I have to also document that I've not given this drug for the such and such a reason. The drug chart has what should I say, codes, so use that code to show why you've not given the given drug. Sign off, and that's it. Okay, so we're going to go on to also other things that we need to do about the sorry, the VIP. This is like the summary. Okay, so you have to, another thing, you have to verbalize the phlebitis score to the to the examiner. So another thing, VIP means visual infusion phlebitis. Okay, so this one is like a summary. Check all the equipment, check the cannula for signs of phlebitis. You can check for any temperature, pain on the site. You have to ask the patient to confirm, Jamira, are you having any pain on the site, like where the cannula is? Then saline or edema, red erythema, P pyrexia, P palpable venous cord. Okay, so that brings us to it's called I don't know, everyone can come up with their but me, I was doing it as like pop, but pop with double P. Do you see this? Like, do you know the word pop, but pop with double P? So this helps to remember the phlebitis score in case you forget it, because you have to have it in your mind. So clean hands according to WHO states that trolley has been cleaned with detergent wipes. If you have the green wipes, on the side, so please use them to clean your trolley. Then State's trolley has been cleaned with detergent wipes. Does the ID checks the right medication, check the prescription again. Remember, you have to read everything. When I mean read everything, the drug chart has three pages. Do you see this? This is 1, 2, 3. You have to read everything, so you have to be fast because it's a few minutes for this station. Then for the equipment, then you have to have also 2 alcohol wipes, the syringe to the bedside, and then what else? Then also some other thing to note about the same procedure is you are checking for 5 things in the score. That's what I was telling you. Oh, we shall go through the full score, and if one of them has a score of 1, the assessor answers yes to one of them, you could go on and flash if the score is 0 or 1. Then if the score is 2, 3 or 4 or 5, do not continue to flash. However, this happens very rarely. Most times it is only 1 or none. So your assessor will give you, so confirm with her that if you're, remember you're working on a dummy, so the assessor will tell you either to go on if you have a score or not. Okay, so I think we've been through that, everything. Unless I give you another demo. So this is another new station. Perform hand hygiene according to WHO. Go to the patient and introduce yourself. Can you confirm your name and date of birth, please? Do you have any allergies? I'm happy I have the right patient. I have come to assess your IV infusion site because you have a cannula in place, and it is expected to be assessed every 12 hours and have a flash given. Okay, so you don your PPE, assess the site for readiness, warmth, temperature, swelling, venous palpable cord. Then you ask the mother, if having any pain, it looks okay, I'm happy to give you the flash. I'm going to give you a call bell to call whenever you need me. So I'll go on and prepare the flash. Okay, so then after you give the flash, you discard your PPE, you wash hand hygiene, so you confirm with the assessor if your tray is clean. Read the prescription chart loud according to in the steps, name, date of birth, NHS number, as I showed you how it is. Then the medication is intact, safe to use, date of expiry, safe to use, and put on the tray. Then you go on again. Please confirm. Clean the pot with alcohol swab for 30 minutes. You know that pot, that purplish things on the when the cannula, that's the pot. Okay, so you clean the pot with alcohol swab for 30 seconds and leave it to dry for 30 seconds using the non-touch sterile technique. I will connect the pots to each other and administer using the pulse and stop method until the 10 mils is given. Pulse and stop, pulse and stop. If you feel any discomfort, please let me know. I'll stop right away. The medication is given. Clean the pot with alcohol wipes and wait for 30 minutes. Discard in the waste bin. Document the IV flash given and the VIP score. Discard. Injection, do not recap injections, and also put the gown and put the PPE in the yellow bin. Oh my Jesus, thank you so much for watching. That's it about that. VIP. Should I go through the phlebitis score? Let me go through it briefly. For someone who cannot be able to access it, I think I need to just give you. Okay, and let me just read it for you from 0 to 5. So if you're watching this video, you have everything in mind. Okay, so 0 is the VIP score is from 0 to 5. Okay, so it is 0. IV site appears healthy. that's 0, which means there is no signs of phlebitis with 0. Then with 1 of the following signs is evident: slight pain near the IV site or slight redness near the IV site. Okay, that's score 1. Let's go to score 2. Score 2 is pain at IV site, redness, swelling. Okay, let's go to score 3. Score 3, all of the following signs are evident: pain along the path of the cannula, there is redness around the site, there is swelling. Okay, then let's go to 4. All of the following signs are evident and extensive: pain along the path of the cannula, redness around the site, swelling, then there is a palpable venous cord. Then let's go to 5. All of the following signs are evident and extensive: there is pain along the path of the cannula, there is redness around the site, there is swelling, there is a palpable venous cord, and there is pyrexia. Okay, so that's the VIP score. So from 0 to 5. If you have any question, please leave it in the comment section below. I'll come back and answer. Then if you've not yet subscribed, please press the subscribe button, and please advise me on which videos you want to listen to still about the same. Okay, where you need clarity, I will be happy to make some videos for you. Okay, sharing is caring. Remember, I'm sharing what I know. I'm not a guide. I'm not an examiner. Guys, thanks for watching. Come back. Okay. I can't wait to see you again. Here, keep watching, comment, recommend to your relatives and friends. Recommend to your sisters. Recommend to everyone who wants to learn something. And also comment, let's interact. Where you think I have made an issue, comment. Let's learn. Let's learn from each other. I'm open for corrections. If you feel I have made an error, I'm open for corrections. Open for corrections. Okay? Otherwise, that's it. Let's meet again. So I think I'm going to go on and do a removal of the urinary catheter, and then we also have postnatal care, then we have intramuscular injection. How is that? Let's go on. Let's